You know, a lot of times certain words come up in our vocabulary and they come in favor and people use them a lot, and then they sort of go out of favor for whatever variety of reasons. One that I used to hear a lot, people would be complaining about discomfort and they'd say, oh, it's my sacroiliac. Well, joining us today, Dr. Gerayli, and we're going to talk about that, sacroiliac. What is it, and a little bit about it, and how it can be made uncomfortable, and then how you can make it be less uncomfortable. So, where is it? What is it?
Thanks for having me on the show again, Rob. I think a picture's worth 1,000 words. I brought my little friend, Mr. Spine, here to show you where the sacroiliac joint is. You know, in the past, we've talked about a variety of different parts of the spine that can cause pain. We've talked about the vertebral bodies, the discs, the nerves. But one of the areas that can cause back pain that's not directly related to our spine is the sacroiliac joint, which is oftentimes underdiagnosed and perhaps misdiagnosed. The sacroiliac joint, if we can show, is where the ilium, or the pelvic bone, is attached to our sacrum. And that's where the name sacroiliac comes from. It's a joint that does not necessarily move a whole lot in our day-to-day activities. However, it's like any other joint, a synovial joint where it contains a slight amount of synovium, which is the lubricant that's in the joint. In females, it does tend to open up slightly during childbirth. So with hormonal changes, the ligaments around the sacroiliac joint can get relaxed and the joint can open up a little bit. Typically, it becomes painful when the joint is going through an arthritic condition. Now, there are several things that can lead to that type of an arthritic condition. One of them would be potential leg length discrepancy. So when we have a leg length discrepancy, there's a tilt in the pelvis. So the pelvis is not straight. It could be off to one side or the other. People with scoliosis deformities who have a curvature in their spine can have a tilt in their pelvis, and that tilt can put pressure more on one side than the other, and as a result there's more wear and tear on one joint, similar to what you would expect if your car was out of alignment and one tire would wear more than the other. As a result, the joint can have inflammatory changes within it, and what happens, if we show it from the back, is that the sciatic nerve that goes down the leg sends small nerve branches, or the nerve branches that form the sciatic nerve also supply the sacroiliac joint. As a result, patients can have sacroiliac joint problems but experience sciatic type pain down their legs. And oftentimes, if they have coexisting disc disease in their spine, that could lead to a misdiagnosed condition where they're being treated for sciatica, but in reality, the problem is in the sacroiliac joint.
It sounds like it's very complex. Who is more likely to suffer from this joint pain?
Mostly folks who have had either trauma to the area. As we spoke earlier, leg length discrepancy can lead to a sacroiliac joint arthritic. But what we see commonly in our practice and in this area are folks who have already undergone back surgery, particularly fusion. What happens with fusion is that part of the spine will, through instrumentation, will be fixed. So if you have fusion in the lower part of the spine, the joints now become a bit more active in day-to-day movements. As you lose the flexibility of the lower part of the spine, there's more pressure that's on the sacroiliac joints, and with various movements, these joints, since they weren't designed, become more inflamed.
So the fix for one medical problem could lead to another.
That's
if the
true.
fix was fusion, it could lead to some other issues then.
That's true. You know, with any time someone undergoes a fusion, our surgical colleagues will always tell them that when you fuse one segment, the level above and below will start to wear a bit faster because it takes on the role of some of those
of the one you fused, yeah. Right. It sounds like you mentioned earlier that misdiagnosis is common in this issue. How do you folks go about diagnosing to get it correct?
Really, the best way to diagnose sacroiliac joint disease is through a good physical examination. Imaging studies are oftentimes not that helpful because you can't really see some of the inflammatory changes in the joint. Once it's really worn out, then obviously X-ray images can be more helpful, and we use them to confirm the diagnosis. But there's some specific physical examination findings that we look for that guide us in that direction.
Would range of motion issues or lack of flexibility be some of the things you'd look for if somebody can't move a certain way?
Absolutely. One of the things that we often hear about is morning stiffness. Just like folks with arthritic changes in their hands, they complain of morning stiffness, and as the day goes on and as they move their joints, they feel warmed up and they feel that the joints are moving a little bit better.
Right.
The sacroiliac joint does the same. Oftentimes patients complain that in the morning when they get up, it's hard to get out of bed, they feel very stiff. As the day goes on and things loosen up a little bit, they feel a bit better.
Good. And finally, treatment procedures, once you've made that diagnosis.
Well, the key thing is really making the correct diagnosis, and once you make the diagnosis, we start with some basic stretches. You'd be amazed how well patients do with just some simple stretches that they can do once or twice a day, primarily because once you stretch the ligaments and the muscles around the sacroiliac joint, some of the pain subsides. At the same time, reducing the inflammation is key. We oftentimes use over-the-counter anti-inflammatory medications that patients can easily tolerate. If that does not work, we go to stronger prescription-strength anti-inflammatory medications. And ultimately, since the joint is easily accessible under X-ray guidance, if patients fail oral regimens, we can also place medications directly inside the joint under X-ray guidance to help reduce the inflammation.
Okay, a lot of options there.
And finally, at the very end, if patients fail everything, in the past, surgeons used to fuse the sacroiliac joint. We no longer recommend that. Most surgeons don't do that anymore. Instead, we have techniques that help us ablate the nerves that supply the joint, a process called radiofrequency thermoablation, where through using radiofrequency lesioning, we can ablate the nerves that supply the joint and thereby make the joint numb so that patients don't feel it.
Sounds like lots of options along the way, but the primary thing seems to be the correct diagnosis, so that's obviously important.
Yes.
All right. Thank you for joining us. So if you are having pain in that part of your body, that may be what's going on. Again, you need to get that looked at, get it checked out, and especially if you've had spinal surgery or spinal fusion, could be leading to that as well, so you want to be sure and get that analyzed. If you want to find out more information, number there on your screen, you can find out more about Dr. Gerayli and the work with the Spinal Pain Specialist Medical Group here in the community as well. Thank you for joining us.
Thank you for having me.
Good to have you in the program today. And we'll be coming back with more as we continue on with our Monday edition here for you of Channel 6 News.